I'm Dr. Vidushi Jain, a practicing dermatologist in Noida Extension and Ghaziabad. Today I will be talking about psoriasis and its impact on patients' life and how we can treat it. Psoriasis is a chronic, inflammatory, relapsing skin condition. And why is it important to treat or diagnose it early? Is because it can have systemic implications. It can have manifestations in other body organs. Now, what are the common sites of affection of psoriasis and how do the lesions look like? So, psoriatic lesions, how do we distinguish them from other skin conditions? The psoriatic lesions have a very thick, scaly appearance. The scales are silvery white and the lesions are fiery red or salmon pink in color. Now, this salmon pink color fades down in a darker skin tone. So we are left with the scales being major diagnostic criteria. The scales, when scaled off or peeled off from the skin, how do we distinguish the psoriatic skin lesions from other skin conditions? Psoriatic skin lesions are generally salmon pink in color. They are scaly. They are thick. The scales, when slowly removed from the skin surface, reveal a glazing surface and pinpoint bleeding underneath. Besides this, the psoriatic lesions show a seasonal variation. In a majority of people, there is winter aggravation, but some people can also show a summer aggravation. The common sites where psoriasis affects the patients are generally the extensors, elbows, knees. They are the most common sites, besides scalp, palms, soles, and also your nails. What are the other forms of psoriasis that you should be knowing about? The most common form of psoriasis is plaque psoriasis, but sometimes when a large body part is involved or when patient suddenly withdraws treatment, the patient can present with pustular or erythrodermic psoriasis. Now, these two conditions are extremely important not from skin point of view, but because they have severe systemic manifestations and require immediate hospitalization. Psoriasis is basically an epigenetic condition. It means that in genetically predisposed individuals, the environmental factors and their lifestyle decides if they would develop psoriasis in their lifetime. So what are these risk factors? Let us have a look at that. First, smoking. Smoking not only increases the severity, but also the number of years the person smokes and how much a person is smoking affects the severity of psoriasis in the patient. Alcohol. Similar to smoking, alcohol also affects severity and the disease progression. Obesity. Obesity in itself is an independent risk factor. How does obesity affect or lead to psoriasis? Obesity promotes inflammation and hence psoriasis. Obesity and psoriasis both would lead to mood changes, decreased physical activity, and in turn lead to a vicious cycle. Fourth, infections. Pharyngitis caused by streptococcal infection can predispose an individual to a form of psoriasis known as guttate psoriasis. Similarly, immunodeficiency caused by HIV virus can predispose to psoriasis. Certain drugs like beta blockers and lithiums are culprits for psoriasis. And then comes stress. Stress definitely is responsible not only for onset but also flare-ups of psoriasis. Whether it has been observed that psoriasis leads to a flare-up in winter season and clears up by summers in most of the individuals. And National Psoriasis Foundation is founded to be the cold weather, the less sunlight, and low humidity which predisposes to these flare-up during the winter season. There are a lot of comorbid conditions associated with psoriasis. The etiology of this multimorbidity can be explained. Number one, the direct effect of the psoriasis disease, the shared genetic susceptibility between psoriasis and the other diseases. Third, the psychological impact of the disease, and fourth is the effect of medication which is being used for the treatment. The most common comorbidities which are associated with psoriasis are, the first is psoriatic arthritis. Now, the early onset of the disease is associated with a higher chance of psoriatic arthritis. Besides that, inflammatory bowel disease, Crohn's disease, and other autoimmune diseases like vitiligo, alopecia areata, autoimmune thyroiditis, and also type 1 diabetes mellitus. Now, second position holds for metabolic disorders. Psoriasis is very strongly associated with the metabolic disorders, hypertension, hyperlipidemia, diabetes mellitus type 2. It is one of the leading causes of mortality in psoriatic patients is cardiovascular disorders. With early onset disease, these cardiovascular disorder risk particularly increases more so because of the behavioral problems like being alcoholic and cigarette smoking being common in these patients. Amongst the cardiovascular diseases, arterial hypertension, venous thromboembolism, and even atrial fibrillation has been commonly observed. Now, amongst the metabolic disorders, a special mention has to be made of obesity. Obesity per se leads to more severe disease, and also medication becomes tougher because the dosage of the medications will be higher, and so will be the side effects. There have been studies which prove that weight reduction particularly improves the disease severity, decreases the severity, and also improves the treatment response in patients. Other comorbidities associated with psoriasis, cancer. There are few cancer which have been reported to be associated. Amongst them, non-melanoma skin cancer is very common. When high doses of PUVA are utilized in treatment, such skin cancers and squamous cell and basal cell carcinoma have also been observed. A rarely Hodgkin's lymphoma has also been observed in patients of psoriasis. Another important comorbid condition that needs special mention is the psychological impact of the disease. Depression. Due to the disease, the medication of the disease, the recurrence of the disease, clinical depression has significantly been reported in patients with psoriasis. Psoriasis is a chronic, relapsing, and a life-threatening condition when it is associated with systemic manifestations. With advancement in the treatment for psoriasis, longer remissions and more safer options for treatments are available. I must request patients who are suffering from itchy, scaly patches or those who actually know that they have psoriasis to immediately consult dermatologists for the best treatment options available. With the availability of newer biologics, the treatment clearance rate, remission rates are much higher, and the life expectancy and the quality of life of the patients have definitely improved. Thank you.